Hey, I'm Macy Williams, and I'm going to be talking about renal transplants today. A renal transplant is when a new kidney, either from a living or deceased person, is given to a person with chronic or end-stage renal disease. There are more than 10,000 renal transplants done each year, and 95% of the people who have this surgery are alive after 1 year. The success rate is much higher if the kidney comes from a living donor rather than a deceased. And the skin and eyes were the first successful transplants ever done, but the kidney was the first complex organ to ever be transplanted. And also, before immunosuppressants were invented, transplants were only limited to identical twins. There are many different complications that can come from renal transplants, but we're only going to talk about a few. Rejection, which is the most common, acute tubular necrosis, obstructive nephropathy, extraperitoneal fluid collections, and graft rupture. The first one is obstructive nephropathy. The early signs of it are anuria and severe oligouria. Obstruction can be caused from ureteral necrosis, abscess, lymphocele, fungus ball, retroperitoneal fibrosis, stricture, and a hemorrhage in the collecting system. It can be identified sonographically as hydronephrosis, and vascular insufficiency can be diagnosed with a color Doppler, and all you'll do is look for high velocity jet with distal turbulence. The second one is extraperitoneal fluid collections, and you can see a picture in this one and the fluid right here posterior to the kidney. Many different types of fluid collections can occur, and this is including a lymphocele and lymph fistula, urinary fistula and urinoma, and hematoma and perinephric abscess. These are collections of lymph, blood, urine, and pus. Sonographically, they appear as round or oval structures with irregular and thickened walls, and sometimes they have thin septations. The next one is acute tubular necrosis, and as many as 50% of patients that have renal transplants will experience this after surgery. It occurs when there's a loss of blood supply to the transplant tissue after surgery, or not after surgery. It can occur anytime. It can occur in the donor before it's even taken out, during transportation, during harvesting, during the surgery, and also after the transplant caused from poor circulation. There will be no changes in the parenchyma sonographically. There may be swelling, which is normal in a transplant patient for up to about a week after surgery, but if it lasts longer than a week, then acute tubular necrosis should be considered. Next, we're going to talk about graft rupture down here. It can occur within the first 2 weeks after surgery, and it presents with an onset of pain, severe pain, and swelling over the graft. It appears sonographically as a gross distortion of the contour of the graft and perinephric or paranephric hematoma. Then there is rejection, which is the most common, and there are 4 different types. And there is hyperacute, which occurs within the first few hours after surgery, and it's caused by vasculitis leading to thrombosis and usually a loss in the graft. Then there's acute. It occurs from days to months after the transplant, and it is separated into 2 different forms, vascular and interstitial. And there is immunologic, It is preformed antibodies, immune complexes, and cell-mediated responses. And chronic, which is a gradual onset and it can occur months after the surgery. And then up here it shows the different parenchyma changes when the patient is going through rejection. You see a enlarged pyramid and with decreased echogenicity, a hyperechoic cortex. There can be a localized area of parenchyma that has an anechoic appearance. And like in this one, the outline is distorted, caused by swelling, and the renal sinus appears compressed and displaced. And there also can be patchy sonolucent areas that involves the cortex and medulla. This shows you the dilated ureter and renal pelvis. The most difficult of complications to diagnose without a biopsy is rejection. And there you go. That's all about renal transplants. Hopefully you learned something. Thank you.